just going to give a few slides, just a bit of an introduction about physio, but I don't stand alone. So just really important to mention that I'm part of the wider MDT, working really closely with Natalie and our in the future, after the end of November, our new channel nurse. So I'll be mentioning interactions with those people as well. So as Deepa's already and Pinky have already discussed, skeletal muscle channelopathies are a group of conditions where the ion channels in the muscles, where that helps the ions move in and out of the muscles to either help the muscles contract or relax, are affected. And this can cause paralysis or myotonia, and as we've talked about in some conditions, a mix of both of those symptoms. So there's a range. We have changes with chloride channels, mostly cause myotonia. Some of the sodium channel mutations or changes also cause an overlap between myotonia and paralysis. And then the calcium channels and potassium channels, as we've discussed already. And there's really a range of symptoms. So the myotonia congenita, paramyotonia congenita, diagnoses individuals may often have that cold sensitivity and suffer more with myotonia, whereas the other end of the spectrum, people may experience more weakness or paralysis. But as we've said, it's really presentation, how each individual is affected is so variable, even within the same family. So it's our role as a team is really to support you to help understand the individual patterns for yourselves, and also think about modifiable factors. So they're the things that trigger or make your symptoms worse, that may benefit from, and you may be able to help best manage your conditions. So at the beginning, we heard about food diaries as a way, so helping to understand the individual effects of certain foods on your condition, on your symptoms. Hot and cold can often trigger, and I think last year we talked quite a bit about, in the group I chaired, we talked about thermals and different ways of kind of maintaining body temperature, even in colder weather. Exercise and rest, we've heard about how that can trigger symptoms or aggravate symptoms, and sometimes allow people to work through, so particularly with the weakness. And we might also be thinking about, working space, schools, office, and the environmental setup for an individual, which can again help manage symptoms. So the CNS role, the clinical nurse specialist role within our clinics, may support around symptom discussions, questions, or adjustments with medications. All of us can provide support letters to help with diagnosis, so perhaps to share information about diagnoses to schools or workplaces. Reproductive options can also be discussed, and anaesthetic advice, as Deepa mentioned earlier. So important considerations are graded exercise, and I'll come back onto this in a few slides' time. But warming up and cooling down, so sometimes thinking about warming up and cooling down for as long as you might be exercising, help the muscles to prepare, and can be really helpful to transition in and out of symptoms whilst managing those symptoms. In and out of exercise, whilst managing those symptoms. Stretching is important for everyone, but some people can find that particularly helpful. But as I mentioned earlier with one of the questions, it's about finding what's right for you. It's not just about the best type of exercise, but something you can do realistically, something you enjoy and are motivated to do. And I wanted to talk a little bit about this boom-bust pattern of activity, which might ring true with some of you. And this is not in no way exclusive to channelopathies. This is something that a number of people with a range of different conditions can experience. But it might be that an individual has a good day, might do above and beyond because they're feeling good, which, is I think anyone would do. But then actually they might find that following that, because there's been a huge increase in their normal level of activity, it might be that symptoms are aggravated, that there's more pain. And overall, there can be a risk that activity levels overall can decrease over time. And this is an important area that we think about with physio, and with nursing and with the doctors as well. So this boom-bust cycle of inactivity can lead to deconditioning, and that's something that responds really, really well to graded exercise. So for any range of reasons, someone might start becoming less active and deconditioned. Sometimes it's following a virus, but sometimes, longer term as a result of not very nice symptoms, weakness and pain following activity. If someone moves into a position where they're avoiding activity for whatever reason, this can lead to the unaffected muscles becoming progressively deconditioned. And that can be the arm and leg muscles, the breathing muscles that help with the lungs as well. That can lead to pain and weakness, making it even harder to become active. And in turn, it can lead to reduced energy and stamina and further deconditioning. So not always easy to address this, but again, feel free to email if you'd like a one-on-one appointment to explore strategies for yourself. But a stepwise approach, graded activity, is really the way to address this deconditioning and to optimize muscle strength. So top tips are thinking about moving little and often, doing what's comfortable, avoiding long periods of inactivity. Also being aware that any kind of movement is helpful. So that might be doing cleaning, getting washed and dressed, hoovering. Any number of things are good for us in counting this activity umbrella term. Sometimes it's helpful to think about planning rest, so doing what feels comfortable, having a rest and coming back, and then increasing activity levels very gradually over weeks and months, not days, and aiming for consistent levels of activity over the week can be a really good approach. So for more information on fatigue for neuromuscular conditions, which is where a lot of this information is from, there's actually a fatigue management guide on the Muscular Dystrophy UK website that people may find helpful to refer to. So now we'll just do a few minutes of Pilates, just to give you a bit of an introduction. So if everyone sits comfortably, have a little wiggle if you need to. Make sure your bottom's at the back of the chair. And if you've got a backrest, see if you can lean against that slightly. So we'll just do some gentle introductory activities to give you a bit of a taste. To start with, if you bring your attention to the crown of your head and imagine that there's a string from the crown of your head up to the ceiling. Think about tension, so pulling up from that string as your neck lengthens, so your crown of your head lifting towards the ceiling. Bring your chin down very slightly and you'll be aware of a lengthening, maybe a softening in the muscles on the back. Now thinking about your shoulder blades, if you have a backrest, you might feel the contact of your shoulder blades on the backrest. I'd like you to visualize, to imagine your shoulder blades melting down towards your back pockets. Again, you might feel a bit of an opening up and a softening around the shoulders. So stretching up through the head, chin down, shoulder blades melting. Now I'd like you all to think about your core, your lower tummy muscles, and we're going to try a few different ways. I'll give you a few different examples that you might find helpful to get those muscles working. So keeping that length through your neck, shoulder blades down. You might find it most helpful to think about having a low belt. So if you visualize a low belt with 10 holes, just think about drawing your lower tummy muscles in just under your tummy button, as if you were tightening the belt to the third hole out of 10. That image doesn't work for everyone. We're all individuals. So sometimes people find it easier to get their core muscles working by imagining their pelvis as a bucket of water. Sounds a bit odd, but bear with me. So if you think of your pelvis as a bucket of water around your hips, just think about tipping the bucket backwards a little. You'll feel a bit of tension in your lower tummy muscles, as if you were dropping a few drops of water out the back of the bucket. Hopefully all of you have found one of those helpful and have got a sensation, a feeling of a little bit of tension in their tummies. I'd like you to keep that tension in your lower tummy again, think about your chin down, shoulder blades melting. And then I'd like you to bring your hands either to your ribs like this, or if that's not comfortable, just to wrap your hands around so that you can feel your ribs on either side. Going to keep those lower tummy muscles working as you start to take a nice deep breath. And this is a lateral breath, or a Pilates breath. Works quite well because it allows you to breathe without losing that tension in your lower tummy. So chin down, shoulder blades melting, lower tummy muscles drawn in slightly. I want you to think about a nice deep breath. And as you breathe in, you might feel your hands moving as your ribs expand, so a bit more space between the ribs as the air comes down to the bases of your lungs. Try and keep your tummy muscles tense and let breathe out. So you might feel your ribs coming in a little bit. Just do that once more. So tummy muscles in, breathing in and breathing out. That's good. So just got two or three more minutes. We'll try adding something in a little bit. And again, I want you to do what feels comfortable. I'm aware lots of people in the meeting today will have various levels of activity and control. So the exercise we're going to aim for is keeping your hands up, keeping your tummy muscles in. I'll just demonstrate and then we'll do it together, and opening one hand out. So for those of you with shoulder weakness or pain, it might be that you have your hands resting on your knees, or if you're in front of a table, on a table, and I'll just ask you to slide as far as is comfortable. For those with a bit more control around their shoulders, feel free to lift up, but again, to a level that feels comfortable, and make sure your shoulders don't raise. So coming up with your thumbs. So we'll do a couple of these. Again, do what feels right for you. So thinking about your head stretching up, chin down, shoulder blades melting, draw your tummy muscles in slightly, and take a nice deep breath in as you bring your hands up. I want you to keep your tummy muscles working and breathe out as you open one hand up as far as comfortable. Keep your tension in your tummy and breathe in to come back. So you might need to rest now and reset, take a breath. We'll do one more the other side. And if you feel able, we'll do a couple. And so stretching up, chin down, shoulder blades melting, lower tummy muscles nice and tight. Breathe in, float your arms up to a position that's comfortable. Breathe out as you open, breathe in again. Rest if you need to, or if you feel able. Let's keep those tummy muscles working. Breathing in and opening out. Breathing out and then relaxing. Thank you very much. That's my introduction to Pilates. Hopefully a nice way to start after lunch.